I have seen men in their 70s walk into my office having accepted a version of themselves they never chose. They didn't decide to stop performing. They didn't decide to lose the confidence that used to come naturally in the bedroom. They were simply told at some point along the way that this was what getting older meant. And because the person telling them wore a white coat, they believed it. What if that belief is the single most expensive mistake a man over 50 can make? I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 restore male performance, pelvic strength, and sexual confidence they were told age had permanently taken from them. I want to challenge something you may have been told, that declining male performance after 60 is a structural inevitability, a mechanical problem with no mechanical solution outside of medication. In my clinical experience and in the research I follow closely, that belief is far more negotiable than most men realize. There is an exercise. It is ancient. It requires no equipment, no gym membership, no prescription, and no special window of age before it stops working. And the evidence behind it is some of the most compelling I have encountered in 12 years of clinical practice. Before we go further, I want to hear from you. Drop a comment below and tell me one thing you have quietly accepted about your performance that you are no longer sure you should have. I read every comment. And hit that like button so this information reaches the men who need it most, because too many of them are still sitting in that resignation, and they don't have to be. Here is the reality that most men over 60 have never been given a complete picture of. Erectile function, urinary control, pelvic stability, and sexual performance are not primarily hormonal issues, and they are not primarily vascular issues, although both of those factors matter. At their mechanical foundation, they are muscular issues. Specifically, they depend on the health, strength, and neuromuscular coordination of the pelvic floor. A hammock-shaped group of muscles spanning the base of the pelvis that most men don't know they have never consciously contracted and have allowed to weaken steadily over decades without any awareness that the weakening was happening. The pubococcygeus muscle, the bulbocavernosus muscle, the ischiocavernosus muscle, these are not obscure anatomical footnotes. They are the active mechanical components of male sexual performance. The bulbocavernosus muscle compresses the bulb of the penis during erection, trapping blood and maintaining rigidity. The ischiocavernosus muscle sustains penile pressure during the erection cycle. The pubococcygeus supports bladder control, ejaculatory force, and the rhythmic contractions of orgasm. When these muscles are strong, coordinated, and well innervated, male performance reflects that strength. When they are weak, atrophied, and poorly coordinated, as they are in the vast majority of men over 60 who have never trained them, performance reflects that weakness instead. And here is what makes this so important and so overlooked. These muscles respond to training at any age, not partially, not marginally, robustly. The research on pelvic floor training in men is unambiguous on this point, and it is one of the most encouraging bodies of evidence in men's sexual medicine. The ancient exercise I am going to walk you through today is the Kegel, named for Dr. Arnold Kegel, who first described targeted pelvic floor rehabilitation in the 1940s. It has been practiced in various forms across cultures for far longer than that. And the clinical evidence behind it for male performance restoration is something every man over 50 deserves to know. Today, I am going to walk you through 5 things that happen to your performance when you commit to this exercise consistently: the biology, the emotional reality, and the exact protocol to start tonight. Number 1, pelvic floor training directly restores the muscular mechanism of erection that medication cannot replace. Here is the biology most men have never heard. An erection is not simply a matter of blood arriving in the penis. It is a matter of blood being trapped there under sufficient pressure to create rigidity. That trapping mechanism is muscular. The ischiocavernosus and bulbocavernosus muscles contract to compress the veins that would otherwise allow blood to drain out of penile erectile tissue. When these muscles are strong and responsive, they generate intracavernous pressures far exceeding normal arterial pressure, creating the firm, sustained erection that reflects a fully functional system. When they are weak, Blood arrives but drains too readily. The result is the partial erection, the erection that doesn't sustain, the erection that requires constant stimulation to maintain, experiences that are not vascular failures but muscular ones. A landmark randomized controlled trial published in the British Journal of Urology International assigned men with erectile dysfunction to either pelvic floor muscle training or lifestyle advice alone. After 3 months, 40% of men in the pelvic floor group had fully recovered normal erectile function. 35.5% had significantly improved. Compare that to the control group, where no men recovered. A follow-up study confirmed that pelvic floor training outperformed lifestyle intervention alone and produced results equivalent in many cases to PDE5 inhibitors, the class of medication that includes the most commonly prescribed erectile dysfunction drugs, without a single side effect. Your body has more capacity for restoration than you have been told. Emotionally, the loss of erectile reliability carries a weight that goes far beyond the physical. It touches a man's sense of himself, his confidence in intimacy, his willingness to be present with a partner, his private relationship with his own body. Many men begin to avoid intimacy entirely, rather than risk the vulnerability of an unreliable response. That avoidance compounds the problem neurologically and relationally. When erectile function begins to return through pelvic floor training, men don't just describe a physical improvement. They describe a return of ease, a return of confidence, a return of the part of themselves they had quietly been grieving. That return is within reach. Practically, the foundational Kegel contraction for men is performed by contracting the muscles you would use to stop the flow of urine midstream, or to prevent passing gas. The contraction should be felt at the base of the pelvis and deep within it, not in the abdomen, the buttocks, or the thighs. If you feel those areas tensing, you are recruiting the wrong muscles. Isolating the pelvic floor takes practice, and that practice is itself therapeutic. The neuromuscular reconnection that training builds is as important as the raw strength it develops. Begin with this. Contract the pelvic floor muscles firmly, hold for 3 seconds, then release completely for 3 seconds. That is 1 repetition. Do 10 repetitions. Rest for 60 seconds. Do 2 more sets of 10. This is your starting point, and you can do it tonight, lying in bed, sitting in a chair, standing at the kitchen counter. No one will know you are doing it. It requires nothing except intention. I want to tell you about a patient of mine. His name was Walter, 73, a retired judge from the Mid-Atlantic, dignified, private, and deeply reluctant to discuss what had been happening for the previous 4 years. His erectile function had declined progressively since his late 60s. He had tried medication and disliked the side effects. He had largely withdrawn from intimacy with his wife of 41 years, telling himself and her that it was simply age. When I explained the muscular mechanism of erection and introduced pelvic floor training, something shifted in his expression. He said, "You mean there's something I can actually do?" 6 weeks into consistent training, Walter called the office. He didn't need an appointment. He just wanted someone to know. He said, "It's working. Something is coming back." That call is the reason I do what I do. Number 2, this exercise restores ejaculatory force and sensation that most men assume is permanently lost. This is the aspect of pelvic floor training that men are most surprised by and most grateful for. Ejaculation is, at its mechanical core, a muscular event. The bulbocavernosus muscle contracts rhythmically during orgasm, propelling semen forward with force proportional to the strength and coordination of those contractions. In younger men with strong pelvic floors, ejaculation is forceful. The contractions are powerful and clearly felt, and the sensation of orgasm is sharp and intense. As the pelvic floor weakens with age and disuse, those contractions become weaker and less coordinated. Ejaculatory force decreases. The sensation of orgasm flattens and dulls. Many men over 60 describe orgasm as a shadow of what it once was, present, but diminished in a way that is difficult to articulate and almost never discussed. Research published in the Journal of Sexual Medicine found a significant positive correlation between pelvic floor muscle strength and ejaculatory function, including force, volume, and subjective intensity of orgasm. The mechanism is direct. Stronger bulbocavernosus contractions produce more forceful ejaculation and more intense orgasmic sensation. This is not a permanent loss. It is a muscular deficit, and muscular deficits respond to training. Emotionally, the flattening of orgasmic sensation is one of the most quietly demoralizing aspects of male sexual aging, and one of the least discussed. Men rarely name it to their doctors. They absorb it privately, add it to the accumulating list of things that used to be different, and conclude that this is simply what getting older feels like. It doesn't have to feel that way. The research shows this is genuinely possible to change. Reclaiming the intensity of sexual sensation is not a young man's privilege. It is a muscular capacity that responds to training regardless of age. Practically, as your baseline pelvic floor strength improves over the first 3 to 4 weeks of training, you will begin adding what are called fast-twitch Kegel contractions, rapid, sharp contractions held for just 1 second each, released fully between each one. These target the fast-twitch muscle fibers of the pelvic floor that are specifically responsible for the rhythmic contractions of ejaculation. Add 2 sets of 20 fast-twitch contractions to your daily routine at the 3-week mark. The combination of slow hold contractions for strength and fast twitch contractions for coordination is the complete protocol for ejaculatory restoration. Number 3, pelvic floor training resolves the urinary symptoms that are stealing your sleep, your confidence, and your quality of life. Let's talk about something most men over 60 live with but rarely connect to pelvic floor function: the urgency, the sudden, compelling need to reach a bathroom immediately. The frequency, waking 2, 3, 4 times a night. The leakage, the small but deeply embarrassing loss of control that follows a cough, a sneeze, or a moment of laughter. These symptoms are not inevitable. They are not simply the consequence of an enlarged prostate, though prostate enlargement contributes. They are, in large part, the consequence of a pelvic floor that has lost the tone and the reflexive coordination to maintain continence under pressure. A comprehensive systematic review published in Neurology and Urodynamics analyzed the results of multiple trials examining pelvic floor training for male urinary incontinence and urgency. The conclusion was consistent across studies. Pelvic floor training significantly reduced both the frequency and severity of urinary urgency, nocturia, the medical term for nighttime urination, and stress incontinence in men. For men who had undergone prostate surgery, the evidence was even more striking. Aggressive early pelvic floor training reduced the duration of post-surgical incontinence by weeks compared to men who did not train. Emotionally, disrupted sleep is not a minor inconvenience. It is a physiological assault on every system in your body: your testosterone production, your cardiovascular health, your cognitive function, your mood, and your ability to be present in your own life. Men who are waking 3 times a night are not just tired. They are operating in a state of chronic sleep deprivation that compounds every other health challenge they face. When nocturia resolves, even partially, men describe it as one of the most significant quality of life improvements they have experienced. Not because sleeping through the night is glamorous, because it is foundational. Everything else feels more possible when you are rested. Practically, for urinary urgency and frequency, a specific technique called urge suppression is trained alongside the Kegel itself. When you feel a sudden, strong urge to urinate, rather than rushing to the bathroom, which reinforces the urgency signal, you perform 5 rapid pelvic floor contractions in quick succession. This activates the inhibitory reflex that suppresses the bladder contraction driving the urgency. The urge diminishes. You walk to the bathroom calmly rather than rushing desperately. Over 4 to 6 weeks of consistent practice, the frequency and intensity of urgency episodes decreases measurably for the majority of men who train this way. Let me tell you about another patient. His name was Marcus, 69, a retired firefighter from the Pacific Northwest, physically strong, accustomed to discomfort, but genuinely worn down by 4 years of waking 3 to 4 times a night. His daytime urgency was affecting his willingness to travel, to attend his grandchildren's events, to go anywhere unfamiliar without mapping the bathrooms first. He called it, with the particular bluntness of a man who spent 30 years running into burning buildings, humiliating. When I introduced him to pelvic floor training and the urge suppression technique, he was skeptical. At week 4, he sent a message through our patient portal. It said simply, "Slept through the night twice this week, first time in years." By week 8, his nocturia had reduced from an average of 3 episodes per night to less than 1. Marcus told me, "I forgot what it felt like to wake up actually rested." That memory, the memory of what your body is capable of, is worth reclaiming. Number 4, this exercise rebuilds the neuromuscular connection between brain and pelvic tissue that determines everything about performance. Here is a dimension of pelvic floor training that goes beyond muscle strength and into something more fundamental. Every muscular system in the body depends not just on the size and strength of the muscle fibers themselves, but on the quality of the neural pathways connecting the brain and the spinal cord to those fibers. This is called neuromuscular coordination, and it determines how quickly muscles respond, how completely they contract, how efficiently they recover, and how well they perform under demand. In muscles that are rarely or never consciously activated, and for most men, the pelvic floor falls precisely into that category. The neuromuscular pathways atrophy from disuse. The brain loses its crisp, high-resolution connection to those tissues. Signals become slow, incomplete, and inefficient. Research published in the journal Neurology and Urodynamics has demonstrated that pelvic floor training in men produces measurable improvements in pudendal nerve conduction, the primary nerve pathway serving the pelvic floor and external genitalia. This means that the training doesn't just strengthen muscle fibers, it rebuilds and sharpens the neural communication network that those fibers depend on. The result is faster reflex responses, more complete muscular contractions, better coordinated performance, and, crucially, enhanced sensitivity and sensation in the tissues served by those neural pathways. This is the mechanism behind the reports men give of enhanced penile sensitivity and more intense orgasmic experience after pelvic floor rehabilitation. It is not psychological, it is neurological, and it is real. Emotionally, the reconnection with pelvic tissue that training produces has a quality that men often describe as rediscovering a part of themselves. For decades, these muscles operated invisibly, below the threshold of awareness. Training brings them into conscious experience for the first time. Men become aware of a region of their body they had never consciously inhabited. That awareness itself, the felt sense of the pelvic floor as a muscular structure that belongs to them, that responds to their intention, that strengthens under their direction, produces a kind of embodied confidence that extends well beyond the physical outcomes of the training. You are not done. The potential within your own body is greater than you have been shown. Practically, to enhance the neuromuscular component of your training, perform 10 of your daily Kegel contractions with your full conscious attention directed to the specific sensation of the contraction. Close your eyes. Feel the lift and squeeze at the base of the pelvis. Feel the release. This is not passive exercise. This is active neuromuscular re-education. The quality of your attention during the contraction is as important as the strength of the contraction itself. Train with presence, not just repetition. Number 5, consistent pelvic floor training creates a compounding return. Every week of training builds on the last, and the improvements continue well beyond the point most men expect. This is perhaps the most important thing I can tell you about this exercise, and it is the thing that separates the men who transform their performance from the men who try it for 2 weeks and conclude it isn't working. The pelvic floor responds to training on a timeline that is different from skeletal muscles. The neuromuscular reconnection happens first. Within 2 to 4 weeks, most men notice improved bladder control and a new awareness of the pelvic region. Strength improvements follow, typically becoming noticeable in erectile function and ejaculatory force between weeks 4 and 8. And the deeper structural changes, improved vascular tone in pelvic tissues, enhanced nerve conduction velocity, restored collagen architecture in connective tissue, continue accumulating for months beyond that initial phase. A 3-month clinical trial published in Urology found that men who completed a full 12-week pelvic floor training program continued to show measurable improvement in erectile function scores at a 6-month follow-up, after they had stopped the structured program and were simply maintaining with a reduced training frequency. The body consolidates and extends the gains made during active training. This is not a short course of treatment. It is the beginning of a new relationship with a part of your body you were never taught to inhabit. The research on long-term pelvic floor training in men over 60 shows consistent, meaningful improvements across all domains of male performance for the duration that training is maintained. There is no age cutoff in the evidence. There is no point at which the literature says the pelvic floor stops responding. Men in their 70s and their 80s in clinical trials showed improvements comparable in direction and proportion to men in their 50s. This is not inevitable decline. This is negotiable biology, and the negotiation begins tonight. Emotionally, there is something quietly profound about a man in his 70s or 80s discovering that his body is still capable of meaningful change. The cultural narrative around male aging is almost entirely one of subtraction. Things lost, abilities diminished, capacities surrendered. The experience of genuine physical restoration at an age when restoration was assumed to be impossible challenges that narrative at the deepest level. Men who go through this process don't just feel better physically, they carry themselves differently. Their relationship with their own future changes. They stop anticipating only loss and begin anticipating the possibility of gain. That shift in orientation is, in my clinical observation, one of the most powerful things a person can experience at any stage of life. Here is your complete protocol to start tonight. It takes less than 10 minutes and requires nothing except the body you already have. Step 1. Weeks 1 through 2. Perform 3 sets of 10 slow hold Kegel contractions daily. Contract firmly, hold for 3 seconds, release fully for 3 seconds. Rest 60 seconds between sets. Do this lying down at first. Gravity-assisted positions make the initial neuromuscular connection easier to feel. Morning and evening are the most effective times. Step 2, weeks 3 through 4. Add 2 sets of 20 fast twitch contractions. 1 second contract, 1 second release, rapid and sharp. These train the fast twitch fibers responsible for ejaculatory force and reflexive continence. Keep the slow hold sets as your foundation. Step 3, weeks 5 through 12 and beyond. Increase slow hold duration to 5 seconds per contraction, working toward 10 seconds over subsequent weeks. Add a standing set. Perform 1 complete set of 10 slow hold contractions while standing, which adds gravitational load and accelerates strength development. Practice the urge suppression technique whenever urgency arises. That is your complete protocol. Start with step 1 tonight. The only requirement is that you begin. Gentlemen, I want to leave you with something I believe deeply and have watched the evidence confirm again and again. The men who transform their performance after 60 are not the men who had better genetics or better luck or better access to expensive treatments. They are the men who refused to accept the first explanation they were given. They are the men who heard the words, "This is just aging," and decided to ask whether that was actually true. What you have learned today is the answer to that question for one of the most impactful, most evidence-backed, most accessible interventions in men's sexual and urological medicine. The answer is, this is not just aging. This is a muscular system that has been waiting for your attention, and it will respond. If this video gave you something real tonight, give it a like so other men can find it. Leave a comment below. Tell me which of these 5 benefits matters most to you personally. Share this with a man in your life who has quietly given up on his performance, because giving up is not the only option available to him. And subscribe to this channel so you never miss the evidence-backed, clinically grounded content I create every week for men over 50. I'm Dr. Emily Carter. Your pelvic floor has been waiting. Your performance has not written its final chapter, and tonight is as good a time as any to begin. Take care of yourself, and I'll see you in the next one.